Hello everyone, my name is Márcia. I'm a nutritionist and master's candidate, and today I'm going to talk about leucine does not improve muscle mass gain nor decreases inflammation in cancer patients. Cachexia is an underlying multifactorial syndrome of complex etiology, and involuntary weight loss, reduction of functional activity, immunological, metabolic, and inflammatory changes are among its features. It is characterized as an important and progressive loss of skeletal muscle mass and a significant presence of the inflammatory process that causing metabolic chaos in the host. Inflammation is the driving force of major catabolic events in the cancer patients. Head and neck cancer is the 60th most prevalent type of cancer worldwide, and it can be defined as the set of tumors manifesting in anatomical structures in the oral, nasal, lips, pharynx, and larynx, with the exception of nervous system and brain tumors. The most common type of tumor that develops in this region is squamous cell carcinoma, and the main risk factors are alcohol and tobacco. The worsening of head and neck cancer does not only result from systemic factors, but also from the location of the tumor, which impairs adequate nutrition, whether due to obstruction, local pain, chewing problems, or even anorexia. Nutritional status and inflammatory process play an important role in disease progression and prognosis too. And considering the location of the tumor, the prevalence of cachexia in patients with head and neck cancer can reach 52%. Studies show that there is a strong link between the loss of skeletal muscle mass and the loss of functionality, generating a deficit in response to treatment and a worse prognosis. Muscle mass is controlled by the relationship between the rates of protein synthesis and degradation. Some intra and extracellular factors can regulate and stimulate the protein synthesis and muscle mass gain too, including amino acids. Leucine is an essential amino acid that belongs to the branched chain amino acids group, and leucine can stimulate the mTOR pathway, which is the main protein synthesis pathway. So, the aim of the study was to investigate whether leucine supplementation in patients with head and neck cancer could attenuate muscle catabolism and modulate the expression of inflammatory factors. This was a double-blind, randomized, placebo-controlled study where a total of 20 patients with head and neck cancer were randomly allocated to undergo one of the two interventions, or leucine or placebo group that was compounded by non-essential amino acids for 28 days. The effect of the supplementation were analyzed and compared, and the following parameters were evaluated at baseline and post-supplementation: body composition, functionality, and inflammatory markers. The pro-inflammatory cytokines were analyzed in the serum, as well as C-reactive protein and albumin, which are important inflammatory markers in the diagnosis of cachexia. Skeletal muscle mass index was assessed by DEXA. Functional assessments were performed using 4-meter gait speed and hand grip strength tests. No statistically significant difference were observed between the groups for any of the evaluated criteria. Body composition and inflammatory markers were unmodified by supplementation. Here, some different criteria were analyzed by this study. To conclude, 4 weeks of leucine supplementation were not sufficient to elicit improvement in the inflammatory profile or muscle mass gain in patients with head and neck cancer. Thank you very much for listening.